Is this thing working? Wait. Let's talk about perverted patients, shall we? Alright, felt a little nostalgic, so I decided to put on the old uniform and stethoscope and basically see if I still fit the darn thing. Back when I was at the bedside, I was propositioned a few times to give someone the old Pamela Henderson, the stranger, if you will. If you don't understand what I'm trying to say and you can't read in between the lines, this is probably, you might be too young. So read in between the lines for me. I have forgotten what this man was there for, but he was propositioning me several times when I walked into the room to care for him and carry out the doctor's orders to do those things for him. And it may happen to you, it's happened to a lot of other nurses. I only know of female nurses of whom this has happened to, but you might be a male nurse, a nurse, and this might have happened to you too. There's some perverted women patients out there, but I'm going to give you some tips and tricks on how to professionally deal with it if it ever happens to you as a nursing student or as a nurse. But as for you, imagine walking into a room, stethoscope in hand, and being greeted by an inappropriate gesture or a comment that just basically makes your skin crawl. If this sounds familiar, you're not alone. Welcome to the dynamic world of nursing, where every day is a new adventure and sometimes you just get met with inappropriate comments and difficult patients that are ready and willing to test your boundaries.
Morning, how are you?
Go to hell!
How are you feeling this morning?
Go to hell!
You doing okay?
Go to hell!
Okay.
So in this video, we're going to dive into some essential tips that will help you handle these perverted patients like a pro. From setting firm boundaries to safety for yourself, we got you covered on all avenues. So sit back, grab a cup of coffee, and learn from this video. In order to navigate the complex world of patient interactions, you have to understand what is inappropriate behavior and what is a misunderstanding. You have to understand the psychology during perverted interactions. A lot of times this may stem from current stressors, but also personal history. As a nurse, you must maintain firm boundaries, not only for your safety, but also to maintain professionalism. We have to first understand these behaviors in order to manage them effectively and create a space for a therapeutic relationship to grow from there without compromising integrity. Knowledge in this area helps to build resilience and ensures that we maintain the professionalism in our role while also building that respect, fostering an environment of care and respect. So to do this, we have to have meticulous attention to detail. A structured setting not only helps to put you as a professional in someone else's mind, but it also sets firm boundaries. Your communication is the backbone of this environment, and it helps the patient to understand the expectations from the get-go. Establishing nurse safety protocols is essential. You can do simple things like maintaining a safe distance and also articulating the expectations of what this relationship should be like. These kind of things kind of work in harmony to prevent misunderstandings and mitigate the risk of inappropriate behavior. It reinforces a culture of safety, but also respect in the clinical setting. You have to master the art of diffusing inappropriate comments swiftly. Addressing these types of situations swiftly help to diffuse the situation and turn it into a more comfortable situation that is also manageable for you. A quick, witty comeback to an inappropriate comment can help to relieve some of the tension, and also humor, if you use it sparingly, can help to lighten up the mood and redirect the attention of what. But the key here is to steer the conversation and the interaction without having it escalate. Set your tone, watch your tone, and make sure that it doesn't help to exacerbate the situation.
Middle finger to my haters, are you bitch jealous?
I totally understand your frustration, and I'm so sorry that you feel that way.
When you have a calm voice and your tone is controlled, you actually control the situation and reinforce what is expected. It helps to reinforce your role and establish, again, the boundaries. It's sort of a delicate balance of utilizing empathy and assertiveness at the same time, and it helps to showcase your skills as someone that can handle situations with grace and confidence. Body language is also another tool that you can use. Make sure that you are standing firm, standing tall, and that you're making direct eye contact. And this can help to, and also use gestures to support your verbal cues. This can help to put you in their mind as someone that is an authority figure. Nonverbal dialogue also plays a role. You have to really read your patients well and do the body gestures that would suggest that you are an authority figure and someone and a force to reckon with, and to reestablish your role. So if you are communicating with them, you should also use gestures that help to reinforce this. Make sure you are standing tall, making direct eye contact, and using the proper body language to reinforce what you're saying. This helps to establish you as an authority figure and someone that carries themselves with confidence and competence. Don't be afraid to alert your team members as well if you are feeling like the situation is getting out of hand or that you need assistance. Your team members are there to also provide assistance if your communication is failing. They may have some tools in their toolbox that you can utilize as well. A lot of times they'll come in and they'll tag team. They are familiar with this patient because they've cared for them before and they've learned some things from them, or how they interact with people and how to kind of damper down their comments that they're making. So don't be afraid to utilize those other team workers. Don't be afraid to utilize the team and learn from them and grow as well. Doing this also helps to build trust and support and accountability among the team members as well, because you're tagging someone in who can support you and you might be able to give that same support back in another situation. Ultimately, it does foster a more safer environment. Documentation is also crucial in case anything happens down the line. It will be your word against them. So make sure that you are documenting these interactions. You don't have to document verbatim what is going on, but I have seen some charts where nurses have actually put cuss words into the chart verbatim of what the patient said. At the end of the day, it is your word against theirs, and should the hospital or facility that you work for come under fire, it is helpful that you have documented each interaction as detailed as you can. It helps to protect your license, and if you care, protect the facility as well. Documenting helps to safeguard your license, but also helps to protect the integrity of the profession. Now, self-care is going to be crucial, because if you encounter these types of things over and over again, it can really take a toll on you. So make sure that you do things that help to decompress you when you're off of your shift and to help you forget about this interaction. Over time, as they say, time heals all things, heals all wounds, but I don't really go by that. You must do the things that help you to get that therapy. So take care of yourself outside of work. See a therapist if you need to kind of declutter your mind and get rid of the everyday interactions, the bad ones, the negative ones that you might have with patients. Become a member of any support group that may be out there. If there are some, I know there are forums as well, where you can share your collaborative experiences and also learn from other people about how they can cycle through the bad stuff and get to a good place, a good headspace again when it comes to these types of situations. Over time, your skills with handling these types of situations will become more firm, more competent, more confident, and you will be seen as the professional that you are. So in summary, make sure that you establish clear and concise communication with the patient. Make sure that you set those boundaries. You utilize body language that will help to support those boundaries and support your communication with the patient. Utilize humor in low doses to help redirect and reframe the conversation. Utilize a good mix of empathy, but also assertiveness to make sure that those boundaries are upheld. Read your patient to understand when you need to dial it back and when you need to dial it up. Utilize the team for any support and help and any helpful tips as well. And if you need to change your assignment, utilize the charge nurse to keep him or her well informed of your attempts at trying to stop this situation from reoccurring. Make sure that you are documenting the interactions as detailed as you can, as detailed as your facility will allow, because in the end it will be your word against theirs if anything comes of it down the road. You're protecting yourself, but also the integrity and the culture of the nursing profession. Also make sure that you have self-care at top of mind. You don't want to take this garbage home with you or think about it a week from now. This can be damaging inside, so make sure you do the things when you're off to care for yourself, care for your mental, care for you as a whole. If you need therapy, go get it. If you need a relaxing bath, go do that. But do the things that will help you filter through all of this nonsense and to still remain you as the professional that you are. Okay, hope this video was helpful to you. If it was helpful, please like, share, comment, and subscribe, and check out my other videos. I have a lot of helpful tips for you. All right, hopefully you're having a good week, a good day, and I'll see you in the next video. Thank you for watching. Bye.